They think that puberty is just something that you can pause on a whim, that the human body is basically like a Lego set that you can put together and then take back apart. And their idea of treatment is chemical and surgical sterilization for kids.
So like when y'all went to see and seek therapy and your parents took you, what was the advice given from the therapist? What was that like? Did they work with you? How did that go? Like, what was that journey like? Because I would imagine, I think you've mentioned before how the psychologist had told your parents, like, if you don't transition, that you could be at serious risk for suicide. And if I have that wrong, correct me. But I just wanted to talk about that. Like, what was the advice from the therapist to you and your parents?
So my mom and dad and I were given separate pieces of information. I had a few different therapists and psychologists over the next months and years for different reasons. Like some of them transferred out of network, or I just stopped seeing a therapist after I started transitioning. But the first person I found was very deeply unhelpful. And even mom and dad could see that, even though they weren't really allowed to be as part of the appointments, which is another concern of theirs because they were seriously lacking information on what was happening in my life. But they could see from the outside I was not getting better. So they decided, we're going to speak to a psychologist ourselves and really get to the bottom of this. And what they were told was complete lies, first of all.
Wow.
They were told that this was something that wasn't going to be a phase for me, that it was inherent, that I was born this way, and that there was nothing else we could do to treat this other than transitioning me. And they kept manipulating my mom and dad's concern for me and their natural love for me and really twisted it into something to back them into a corner. They told them, well, it's obvious that she knows what she wants. She may be 13 years old, but she's not stupid. She's a smart child. And she's very insistent on this for a reason. But the longer you go without allowing her to become the young man who she really is, the closer she's going to get to suicide. So the choice is in your hands. This is the ultimatum that these doctors use.
Wow.
To make parents say yes to something that goes against the instincts to protect their children that God gave them. And
Wow.
that is what they did with my mom and dad. They weren't
Wow.
told that I actually wasn't suicidal. That's sure, maybe I was having difficulties making friends in school, that I felt like an awkward kid, and I had some issues with my body image, as any 13-year-old girl does, as any kid that age does. But I wasn't there to say, no, I'm not suicidal.
Wow. And do you find, I mean, I know that you're heavily involved in this movement and done the research and obviously lived through it yourself. Is this the message that when parents are taking their children with this to therapists and psychologists, like, is this the overall arching message that they're giving these parents? Do
Yes.
you find that to be the case?
Yes, they insist to parents like mine that that gender dysphoria could be life-threatening if it goes untreated. And their idea of treatment is chemical and surgical sterilization for kids. They think that the earlier you catch a kid, the better, so that they don't go through puberty, so that they don't end up looking like an adult man or woman, and instead you can simulate the puberty of the opposite sex. They think that puberty is just something that you can pause on a whim, and that the human body is basically like a Lego set that you can put together and then take back apart. But that's not how it works. This is not something that happens without consequence, and it certainly hasn't been for me or even for my mom and dad.
Wow. I want to ask, like, what do you think is the motivation for these therapists and these psychologists and these doctors to do this to children? Like, why would they want to do that? Like, why would they want to give that type of advice that would harm children?
I think the most obvious overarching answer that everybody points to is the money. This is something that's shaping up to be a several billion-dollar industry. And the younger you go, the more lucrative it gets, because the longer that somebody is on what is supposed to be a lifelong process. And there's a lot of complications that come with trying to block puberty, with putting an underdeveloped body on wrong sex hormones, and from surgeries. And there's often for the mastectomies, for the implants, for the genital surgeries too, of course, a lot of revision surgeries that go into it. So why would you not want to place, if you're a doctor trying to make money, why would you not try to place a patient on one of the single most lucrative paths in medicine right now, if you can even call it medicine? But I also think that it's something that is a lot more sinister than just money as well. Because a lot of these doctors, including, I think, my own even, they believe that they are making the best choice possible for these gender-confused young men and women and the children. They have been conditioned through their training to think this is life-saving care. They even call it gender-affirming care, and they use all these cutesy terms like top surgery, bottom surgery, affirmation, true happiness, to make these, not just the patients, but also the doctors, safe. We are saving lives by doing this. They think that there's an active genocide being instigated by red states, by red state leaders, even everyday people like you and me. They think that going against the dogma, that seeing the truth for what it is, that these kids are just boys and girls going through puberty, and a lot of these people are going through mental illness that can be resolved in more meaningful, less invasive ways. They think that we hate transgender people and want them dead. They think that reasonable people are the enemy. Right,
which is not the case at all. We're trying to protect children from this stuff, so from the advice, from that moment where your parents got that advice from the psychologist, obviously at some point you entered the medical system. How quickly did things begin to move from that point?
It was, I think, less than a year, if even half a year, from me first going to a psychologist to me having the referrals to the first few medical interventions, which were a chemical castration drug called Lupron to suppress my puberty, and high doses, weekly injections of testosterone at home to make me look and sound and behave more like a young man. I was 13 years old. I was halfway through my 8th grade year, never even had my first kiss yet, when I was put on this path to sexual mutilation.
Wow. And what did the doctors promise? What wasn't explained? Did they discuss the consequences of what could happen through these surgeries or through these puberty blockers? Like, what was the message to you and your parents from the doctors?
For the most part, I got the glittery kind of end of things of, oh, this is going to help you feel more at peace with yourself. You know who you are. You know what you do, who you are best. So we're going to allow you to, and your judgment to take precedence over ours as the adult in the room, was basically the attitude of these doctors. But during the consultations for the different treatments, from the drugs to surgery, some of the consequences were discussed, but not really in comprehensive detail. Most of the complications that I've had from these procedures over the years were not really discussed at all during the appointments. And these are things that I'm having issues with, like 5 years after my last shot. Things like joint pains, pelvic pains, urinary tract issues, very serious quality of life issues that affect me every single day, were not even mentioned or listed. Wow. But it doesn't matter how much you try to tell a 13-year-old kid, you're being medically experimented on. You are going to face permanent consequences from this, and here's what some of those things can be. It doesn't matter. Right. Because you're talking to a child. Children are not equipped to make adult-level decisions around their life that will inevitably affect every single aspect of their adulthood. And I certainly was not.